Okay, we are live. Good afternoon, everybody, and thank you for joining our lecture today. Today, we'll be discussing caregiving and mental health. We have some wonderful social workers from our team here at Rush and the Caregiver Intervention Program, and they'll be so excited to tell you all about caregiving and mental health. We are live. Good afternoon.
So, Danny, do you want us to just go ahead?
Yeah, feel free to go ahead. I have to fix some technology on my end, so you can go
Gotcha.
ahead.
Okay. Well, I guess I will kick us off. Are you able to see my screen, Danny? Yeah, full screen. Ellie, can you see it? Okay. All right, here we go. So my name is Ellen Carbonell, and I'm a social worker in the Department of Social Work and Community Health at Rush. And I'm joined by my colleagues, Diane Mariani and Ellie Vernesco. They're both social workers in the same department. And we all work with the Rush Caregiver Intervention, which we will touch on a little bit in this presentation today. So I'm going to start with a game. In this game, I don't know if any of you are old enough to remember this, but this game is called What's My Line? And What's My Line is a game where you try to guess what the person's job is. And this is a game from the 1950s from TV, and it continued on for a while. So it's sponsored apparently by a couple of perfume companies. One is called Stop At. I don't know why. It seems like maybe it stops you from smelling bad. Hard to know. But anyway, guess what my job is. So here's my story. I was living my life just as it was when suddenly things changed. I was given a part-time job and I felt like I couldn't refuse it. I had to perform the job along with everything else I was doing. The hours for this job are not predictable, and they'll probably increase as I continue to perform it. I'll be on call 24/7 every day, possibly with no time off for holidays or vacations. There is no salary. In fact, I'm paying money out of my pocket to get this job done. And even with all of this, I find tremendous meaning and satisfaction in performing this job. I believe the job is taking a toll on me physically and emotionally, though. But I decided to take this job on, and I wouldn't want it any other way, but I know it's that taking this job is changing my life. So what's my line? Well, this is the job of a caregiver. And this month, November, is National Family Caregivers Month. So I want to start by thanking all of you who are family caregivers of someone in your life, particularly for older adults. It's a big job, and that's what we're going to be talking about today. So some statistics about caregiving. There are over 34 million people in the US providing unpaid assistance and support to an older adult. And these are considered to be people 50 and over. Most of them are female, and over half are over 50 themselves, and they may also be living with some chronic conditions. Most of them, almost all, provide care for a relative, and about 42% are caring for a parent. Caregiving tasks are really overwhelming, and they can even overwhelm a nurse. So I'm going to pass the baton to my colleague, Diane Mariani, who's going to talk a little bit more about this. Diane?
Hi, everyone. So glad to be here today. I just want to check, am I supposed to be seeing the PowerPoint presentation or no?
You should be.
Okay, I don't see it. I just Okay, that's
Ellen, do
okay.
you want to go ahead and share your screen again?
Yeah, sure.
Thank you so much.
Okay, let me stop.
And while Ellen's doing that, I'm going to provide a quote from former First Lady Rosalind Carter, and it's one of my favorites. She says there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. So I think the reason I love that quote is because it really gives us the sense that we're all kind of together in this, because we're going to fall into one of those. We either will now or will fall into one of those categories at some point. So caregiving is probably going to be a part of all of our lives at some point, if it isn't already. And as Ellen started us off to talking about, caregiving being a big job, so to speak. Again, that doesn't mean it's not very fulfilling and rewarding in so many ways, and it meets many of our needs and addresses our values. But it can be very overwhelming because of some of the complexity of the care. So that always varies. But our point is, caregiving tasks can often even overwhelm nurses that some have to perform some of this care. And then we have family caregivers that are generally not nurses, performing some of these complex tasks. And 50% of them are performing complex medical or nursing tasks, such as giving out medications and also administering medications such as IV medications, which is a whole process in itself, changing dressings, which can also be complex depending on if it's a wound, etc. Catheter care, very delicate. Feeding tube, another kind of intricate procedure. And then just handling complex medical equipment. Oxygen has a certain parameters and other types of equipment. Next slide, please. Thank you. So are we checking in with caregivers, family caregivers, to see if they're ready, willing, and able? Well, we're supposed to be doing that. But in spite of how much they are doing, they are seldom asked how they are doing. Do we always ask, are you really ready, willing, and able? And there's no, shame to not quite being ready, willing, or able. Sometimes it comes on very suddenly. And again, because of the complexity and our own potential health issues or capacity issues, it may just not be feasible or possible for us to do it. And then many of us may think we are, but really don't envision or understand what might lie ahead, and how it's going to impact us. So there's a lot of unpredictability with it. So caregiver stress and burnout is real. This is not just my viewpoint. This is just statistically shown. A lot of research has been done on this. And caregivers tend to have higher levels of stress than non-caregivers. I would say a lot of times because they are managing multiple roles. Many family caregivers are working and also taking care of other family members. Could be small children, could be additional relatives. Really depends. Or perhaps a spouse that has medical concerns, and even dealing with their own medical concerns. And then there's isolation that comes. If you're in the role of a caregiver and spending that time providing care, working and providing care, there's not a lot of extra time to be, out and about and connecting with others. Physical demands can include lifting, bathing, toileting, transferring. And depending again on, I actually spoke to a caregiver today that her husband had a recent stroke, and she mentioned that he's a very tall and large man, and she was, a little bit more on the petite side herself, and she has concerns, looking forward of how is she going to be able to support him and help him? So the physical demands are real. And then lack of respite. There is some respite available, but it's not easily available sometimes and not always accessible to all. The common challenges for caregivers, you're probably already kind of thinking of some of them just based on what we've been sharing so far. But you can imagine that many caregivers don't get adequate sleep for a variety of reasons. There could be, listening for their loved one, during the night. There could be, pain medications that need to be provided. There could be toileting that might need to be supported, variety of reasons. And 40% of the caregivers report having 2 or more chronic diseases of their own. And 33%, which is a third of caregivers, report having a disability while they're providing care for someone else. And the vocational strain, 6 in 10 caregivers work while caregiving. And 61% of them have experienced at least one work-related challenge. I would imagine there's probably a few more, just even in scheduling and appointments and such. And then 1 in 10 actually had to leave the job. And I know there's some information recently, and I don't have the stats on that, but you can see even some of this information is as early as 2020 from the National Alliance for Caregiving. And I think those numbers are going to be going up as far as the 1 in 10 having to leave the job. Financial concerns. Ellen mentioned this as she described, the game of like, guess who I am, guess what my role is. There's often financial burden that comes or financial responsibilities that come with caregiving. So a lot of times there's an increase in bills and costs that could be, extra care in the home. It could be, additional copays they have to, just a variety of things that can happen. And then, reimbursement for care. There's a lag in our system in getting that quickly to those who are in need. And Black and Latino caregivers are at higher risk of financial impact. And we can imagine that has a lot to do with our systemic and institutional racism over these many, many years, and the lack of equity that we have in financial equity for folks. 1/3 of financially strained caregivers report borrowing money from others, not able to afford some basic needs such as food, and using up all their savings to meet these challenges. So let's go back a minute to the social isolation. We know that certainly our time over this pandemic has really brought a spotlight to this and increased the social isolation for many people in general. But I would say that for our caregivers, that's kind of been the case for prior to the pandemic, and then even just increased even more. So maybe they were getting some, supplemental support from other family members or neighbors. And then, of course, when our pandemic hit was at its highest, some of that probably wasn't able to happen for safety reasons. And 1 in 5 are reporting social isolation with higher rates of emotional stress and health concerns, adding to that. And it's been reported that social isolation even mimics the effects similar to smoking 15 cigarettes a day. So that kind of tells you the impact on the physical, emotional, mental health of our caregivers. So it's been our experience in our current RUSH caregiver intervention that we are providing for our RUSH folks and our community members, that caregivers report higher levels of depressive symptoms and anxiety than non-caregivers. And this is also statistics from outside of RUSH, but we're seeing that as well with the caregivers that we're working with. 40 to 70% of caregivers have clinically significant symptoms of depression. And then caregivers of individuals with dementia have even higher levels of depression and emotional stress because of the increased level of complexity and care that's needed for dementia concerns. Something that some of you are maybe very familiar with, and some of you this may be a little bit of a newer concept, but there's Pauline Boss years ago, it started getting us thinking about what she calls ambiguous loss. And that differs from ordinary loss or common loss, if you will, in that there's no verification of death or certainty that the person will come back and return to the way they used to be. So as much of a loss as it is when somebody we love passes, there's a difference between somebody that is still, alive, but has changed drastically because of physical or other concerns. And so there's a loss that comes with that, and a loss not just on their own personal abilities, the loss of the relationship between the caregiver and the care recipient perhaps, and just a loss of lifestyle and abilities to do other things and expand and connect with the larger family and society. So there's a lot of layers of loss there. And the impacts of that can be kind of not understood because, it's not well understood. It can kind of be confusing for others. It's not as clear as something that when somebody passes, we all kind of can relate to it and understand it. But not everybody is as familiar or in touch with this idea of ambiguous loss, although it's just as real and just as impactful. And it often then presents the resolution of that loss because, we have to sometimes identify and kind of understand something before we can then, get some support around it. And then Dr. Bezel van der Kolk, I've had the opportunity to meet with him in person a few times. And I got to tell you, the work he's done in trauma has been just phenomenal. And I think about him all the time when I just even think of trauma because of the groundbreaking work that he's done. But his quote is, being able to feel safe with other people is probably the single most important aspect of mental health. Safe connections are fundamental to meaningful and satisfying lives. I think we can all really relate to that, maybe even now more than ever, what it means to feel safe, to be connected, to feel acknowledged, to feel all those types of things. So when that doesn't happen, when we don't feel safe, when, safety at many levels is an issue, and for a variety of reasons, which you see here on the screen, systemic oppression, physical health, all stemming from, and adding to trauma that we might be feeling, it's important where we can have opportunities to feel connected and feel safe. And I'll pass it off to Allie now, who will talk about rethinking the idea of self-care.
So my name is Allie, and I work directly with caregivers in the caregiver intervention here at Rush. And I think it's important to think about why you are a caregiver, what it means for you, what meaning do you attach to being a caregiver. And part of that is thinking about what your values are and what your needs are. Some of it is reframing what it means to be a caregiver. A lot of folks feel sort of locked into this role. Somebody recently used the term feeling like she was in prison, being a caregiver and feeling stuck. So really thinking about why is it important? A lot of people might say it's really important to me to take care of my mom because she took care of me. I don't ever want to be I don't want to leave my home. So if I can keep my mom at home as long as she can be at home, that's important for me. So really owning that reason why you're a caregiver and why you're caring for somebody, especially if the relationship between you and the person for whom you are caring is complicated in any way. We can move on to the next slide. Thank you. All right, set manageable self-care goals. And this can be something small.
You were listening to sleep. You want that on?
It's a way to really incorporate that, address the isolation that Diane was talking about, being able to have somebody over, especially if you feel like you're not able to have the space to get out. But a lot of people might be in the same situation and may appreciate being able to talk about it with you, or just provide respite. And then taking a shower with great smelling soap. Anything that makes you is important to incorporate into this role, and to keep these things part of your life as much as possible. Allowing yourself to say no. This is a big thing. I think that as caregivers, folks tend to feel like they need to do everything, and they're often managing not only the care of the person that of an older adult, but they might be managing their family needs, work needs. It's easy to feel spread thin, and it's easy to feel like you have to do everything. So the idea of saying no is really giving yourself space to do what you absolutely need to do. Also thinking about, how does it feel if you say yes to things that you don't really want to do or you really can't do? A lot of times there's resentment. It makes the situation even more stressful than it might already be in the first place. Plan ahead for others to help. One of the things that we do with the caregiver intervention is we make a list of things that the caregiver is currently managing, and who is responsible for those things. Who are other people that they can reach out to, either a friend or a relative? How can they simplify things by incorporating other people? One of a very small thing, seemingly small, that can make a big difference is somebody simply getting the groceries for you, and being able to kind of take that off the list of things that you have to do. And think outside the box. What are some other things that you can do for help? Again, simplifying certain tasks. I spoke with a caregiver a while ago about getting one of those like grocery delivery services, or where you make, they send you the food and you make the dinner off of the recipes, and that made a huge difference in their lives. It was one less thing that they had to think about. Looking at what are the supports in the community? How can, if you belong to a church or a faith community, how can those folks be helpful for you? Any support groups that might be around. A lot of support groups are virtual nowadays, which is a great tool for a lot of caregivers who feel like they don't have the time to actually go out of the house to attend a support group. We also offer psychotherapy here at Rush, and a lot of caregivers choose to participate in psychotherapy either from the get-go or after they finish with the caregiver intervention. And of course, you are invited to call us at the Caregiver Intervention Program.
And I'm going to pick it up from here and talk about one of the tools that we are able to use with people who are involved in our caregiver intervention. And this is something pretty simple that you all can use as well. It involves just making a grid like this. So you see things, if you think of the vertical line with thoughts and feelings at the top and actions at the bottom, that sort of represents the 0 point. So anything toward the right of that is things that are going to move you toward your goal. And on the other side, toward the away piece, is things that move you away from your goal. So we're looking at what's happening with your life right now that is either taking you in that path of going toward your goals or away from your goals. You can do this really with any subject that you want, but I thought that it would be good to do this with respect to caregiving, since that's what we're focused on today. And here's an example. If you are a caregiver who's feeling overwhelmed and you feel as though you're the primary caregiver for someone, there are thoughts and feelings that may take you away from where you really want to be, which is living a life that feels good to you, that feels fulfilling, and that represents what's most important to you. We talk about the 4 M's in caregiving and in care of older adults, and what matters is one of those M's. What matters most to you and what matters most to the person you're caring for. So in terms of looking at yourself, things that may take you away from, thoughts and feelings that may take you away from your goal of feeling integrated and grounded and that you're living your best life, are things like feeling taken advantage of, feeling guilty, feeling defensive, getting angry at other people for their opinions when they don't participate. And we know, we hear this all the time from caregivers. The 3 of us have been caregivers as well and have felt these feelings too. It's very normal, but it's not where you want to land. And it's really easy to feel stuck sometimes and like you don't have options when you're a caregiver, especially when you're the primary caregiver. Some of the actions that may lead you away from that goal of feeling grounded and integrated are yelling at your family members, avoiding friends, feeling like they don't understand, why even connect with them. It's related to this ambiguous loss, right? That it's really hard for people to understand that many times with caregiving, the losses continue all the way through the course of caregiving. Not accepting help when it's offered is something that's going to take you away from your goals. Not getting exercise, which I know is difficult to do, but thank goodness, one of the very few positive things that has come out of the pandemic is that there are a lot more online options for getting exercise, and it's particularly important in Chicago in the winter. But even something as simple as taking a walk around the block is a chance to get some exercise and sort of clear your head. When you're not doing that, it's taking you away from that sense of integrated being settled. And putting off preventative health care appointments, which is something that is really easy to do when you're a caregiver. We tend to think, I only have energy to put out the fires that are burning hottest. The person I'm caring for has the more important or urgent needs. I can get my things done later on. But if you put off those preventative health appointments, what can happen is that something gets discovered late in the game and is going to require an intervention that will take you off caregiving duty. You won't be able to provide care. So it really is important to do these things as you go along. On the other hand, and on the other side of this thoughts and feelings and actions line, are the things that lead you toward where you want to be. So assuming the best in others, it's hard to do sometimes, but it's important to realize that everybody is pretty much doing their best. It may not look like what you think is good enough. And it may be that they are sort of shoving the responsibility onto you, but they're not doing that because they're bad people. They're doing that because they're overwhelmed themselves, or they only have so much energy and they feel like they can't take anything else on. Or they may be sort of self-oriented, selfish people, but there are reasons why they're that way. They're probably compelled to be like that for some reason. This is something that therapy is really helpful with, kind of sorting that through and figuring out how to come to some sense of acceptance about what other people are offering or doing. Recognizing that my care recipient is doing the best that they can do is a really important piece that will lead you toward your goals. They may be resistant, they may be denying what's going on with them, or even getting aggressive with you, but it's because they have limited resources. And many times, excuse me, it's because their disease has kind of taken over. And that's what's happening. And then accepting that sometimes you need a breather. This is going to lead you more toward what your goals are, to take that breather for yourself. Excuse me one second. Building in time for yourself is an action that will lead you towards your goals. Even if it's only for 2 minutes, even if it's only for 30 seconds or 15 seconds, being able to just stretch a little bit and remind yourself that life is not about this moment. Life is about something beyond this moment. And it's important to just be grounded, to remind yourself of who you are, to remind yourself of what's important to you, and that these things will all pass. Eventually, they will all pass. Getting out of the house is a really great way to sort of pull yourself out of getting stuck in the moment and getting literally a different viewpoint. And then keeping a list of how other people can help, which is something Ellie talked about, is so, so important. Really writing it down. And then when people say, gee, I wish I could help, you can say, you know what? There's one thing I would love for you to help me with, and it's this. And it can be very small things as well as big things. It's important to add both to your list so that you'll have that on hand. The caregiver intervention that we have at Rush has some really dramatic results. These are what we call statistically significant results, which means that it's not just by chance that we see reductions in depression, anxiety, and caregiver burden as a result of the intervention. But it's also what's called clinically significant. So that means that the scores on these tools that we use to assess depression, anxiety, and caregiver burden move from a level where it's really recommended that there be some sort of intervention taking place to a level where no intervention is needed. So these are results that we're really very proud of, and they have held firm over time. I know that we all feel like we can't do it, but with help, you can build a team that can take some of the burden off of you and bring others onto the team to assist you. Some of the team members may be family members or friends. They may be people in the community. They may be professionals at Rush. They may be professionals in your neighborhood or volunteers who are in your area. But we can help you figure out how to expand your care team, even if it feels like it's absolutely impossible for it to change. When we really dig into it, we typically can find that there are other people who can participate on the team and really make a difference. So we hope that you will feel free to give us a call and we can get you started with the intervention. So with that, I will pass back to Danny.
Thank you so much. Lovely presentation. There's been a lot of questions in the chat, so I'm going to be looking
Oh,
forward
great.
to hearing those. But first, I am going to talk a little bit about our upcoming programs that are going to be starting in January. So I know we have a Matter of Balance that's going to be Tuesdays and Thursdays. That's going to start January 11th from February 9th. From January 11th to February 9th from 10 to 12. And this workshop is going to give you some tools to help reduce your risk of falling and just that fear of falling. And you could go ahead with any of our programs, call our central intake line at 1-800-757-0202 to go ahead and sign up for a program or get more information. We also have Take Charge of Your Health coming up. We have it in English and in Spanish. So on the English version, going to be on Mondays, starting January 31st through March 14th from 10 to 12:30. And for Spanish, it'll be on Fridays, January 7th through March 18th from 10 to 12:30. And this workshop, it's going to give you tools and tips to manage your health and chronic conditions and really be that person that's going to take charge of your health and facilitate all your needs and working with your healthcare providers and what you can do to live a happy, healthy life. We also offer our wellness classes. So the next couple of wellness classes that are coming up, it's going to be Chair Strength, which is Mondays starting January 17th through March 7th, 1:30 to 2:30. And then we'll have Gentle Chair Yoga. That'll be on Thursdays, January 20th to March 10th from 11 to 12. And Tai Chi for arthritis and fall prevention. This is going to be on Mondays and Wednesdays, January 19th through March 16th, 11 to 12. And what that is, it's going to just continue that movement and really help you start reducing some of your arthritis pain and just any challenges that you're having throughout movement and really getting you acclimated to being comfortable and starting to lower the risk of falling. And right now it's such a challenging time with, I know throughout the presentation, we're talking about caregiving and mental health and social isolation, but definitely take advantage of the caregiver intervention program that the wonderful social workers today were discussing. We can go ahead, I'll put that number in the chat as well for the individuals that are chiming in. And then as well as we also have a few other programs such as the Senior Connections for the Friendly Caller. So that's a program that you'll get a weekly call from a friend or a volunteer or someone that relates to you, maybe another older adult. And you can have just a friendly conversation, talk about groceries, talk about what you did or made for dinner. I know Allie mentioned one of those kits where you can order and they have the ingredients for you, just got to cook it. So you can talk literally about anything that you want, and just kind of helps increase that isolation, especially during this challenging time. As well as some of our support groups that we have, friends and family of people with memory loss. That's the second Monday of each month. That's an ongoing support group and it's from 6 to 7:30 p.m. Coping and Connection in the Time of COVID, again, an ongoing support group, the third Wednesday of each month from 3 to 4. And then Diabetes Education and Support Group, it's going to be the third Thursday of each month from 2 to 3. And these phone numbers are on our website as well as right here. So if you wanted to get connected with the COVID group, it's 312-535-8110. And Diabetes and Education is 312-535-8110. And then we want to hear from you. So I know today was specifically about caregiving and mental health. If you're a caregiver, share your story. We want to know on what ways that you're learning to adapt to make it a little bit easier. It's a challenging role and we appreciate that you're taking it on. But if you wanted to share your story on what matters to you as an individual, as a caregiver, go ahead and record a video, short video, 60 seconds, and we'll be able to use that video to help spread the awareness throughout our team at Rush Generations, as well as Shaman Senior Voices. And then our next lecture coming up is the new norm. So that lecture is going to be by the Rush Generations team. And we're going to be discussing what is the new norm? Do we know what the new norm is going to be? Is it going to be going back into programs in person? And how does that look? Are we going to continue virtual? So it's going to be a lot of updates, and then also how we're going to just adapt to this new normal as we're going through the COVID pandemic. That's going to be Wednesday, December 8th from 1 to 2:30. Okay, so now we're going to open it up to some question and answers. And I always want to give the opportunity for our callers that are calling in. If you have a question, feel free to dial *6 to unmute yourself and ask questions. I'll give you a couple of minutes and we can also start going into questions in the chat as well. But I also wanted to just see if we have any questions from our call in. And then Ellen, if you can just share that number in the chat for me so I can share it to our team for the Caregiver Intervention Program.
Sure.
That would be great. Okay. Perfect. Okay. I'll go ahead and start with the chat. Again, if you're calling in, if any questions come, go ahead and unmute yourself by hitting *6. And then I'm just also typing in that number for the Caregiver Intervention. The Caregiver Intervention Program is 312-563-0350.
And Danny, just so you know, we're not able to see the chat, so if you could read questions to us, that'd be great.
Of course. So the first question that we have, it's are there any HCPs, psychologists, or psychiatrists that specialize in helping caregivers at Rush? I know we kind of were mentioning just a caregiver intervention program, but if you wanted to elaborate a little bit more on that.
A lot of what the work is that we're doing is spreading the word throughout the hospital about the caregiver intervention and about the fact that we can help. So actually physicians are able, anybody actually who works in the hospital is able to send someone to us. A lot of times what happens with physicians is that they have limited time to work with their patients and they don't feel like they've got the time to start having a conversation about how the caregiver is doing. Now, you know, of course, we're trying to push the education with them about the fact that it actually pays off for the care recipient. We have some data that shows that it reduces hospitalizations, the length of time people are in the hospital, and the number of times they need to go to the emergency room. But not everybody is aware of that, so we're pushing that education. There are not physicians at Rush that I know of who have caregiving as a specialty, but I would say that the group of people who do have caregivers as a specialty is us. So feel free to reach out.
Thank you. Another question is, you mentioned respite a few times. What is respite and how do I get it?
Sure. Diane, do you want to answer that?
Sure. So respite care is basically time to yourself or time away from caregiving, so to speak. And there are respite services that are generally offered through Department on Aging, and Allie, my colleague, will correct me if I'm off on this. So usually senior services has, a variety of offerings, including what they call adult day services. So it could potentially go to services, although I think they just started opening up some of the senior centers recently because of the COVID situation, they were, those centers were not able to have in-person respite. So basically there's a variety of forms. Sometimes it can be somebody coming into the home to provide some time where the caregiver then can take time for themselves, whatever that looks like. There can be the senior centers or the adult day services can be available. And also, I believe there could be overnight services too, but I don't know if that's offered through Department on Aging or if that's a paid service that you can connect with. Happy to be able to compile some of that information. Sorry, I'm just kind of going off of, I don't have my resource binder handy, but happy to send that over to Rush Generations if that needs to be sent out or if that would be helpful.
Allie, do you have additional information about that?
I was going to say, if you're caring for a veteran, check those benefits too, because there's really good respite benefits that you might be eligible for.
Yep. Good point, Allie.
Awesome. Yeah, and I know a few people are also asking, just if you have information about that, you can send it my way at Rush Generations. And someone was also asking in the chat, would you be able to share a copy of the opening activity? What's my line? Some people are interested in having that.
Sure.
Awesome. So we'll go ahead and get that out to those that requested that. Okay, this is a big one. So this question is for tip number 3. How do you respond to other family members when you say no?
Can you repeat that?
So they want to know how to respond to other family members when they say no.
Yeah, that can be tricky. But I think that just really, it's good information to have, because then you know who to ask in the future and who, of course, who not to ask. If it's it could be just, sometimes somebody can't do it. And it doesn't necessarily rule them out all the time. But also it's a good opportunity to take pointers on what some good boundaries are. We can't do everything all the time, but it doesn't necessarily mean that we always can't do anything. If that makes sense.
Yeah, I'm also thinking, Allie, because both you and Ellen talked about making the list. Some of those things are small things and some of those are bigger things. Mm-hmm. So perhaps if you get a no from a family member, perhaps there's something else on the list that could be a yes. Maybe it's something just a little on the smaller side, or and if nothing on the list, maybe it's like, is there, do you have some thoughts on what you could do to support, and I know that's not always easy to have that conversation. But, maybe we can go with the don't take no for an answer, or at least for an initial answer, and just kind of, to see if there's anything else. And if not, then like Allie said, you kind of know where you stand, and maybe that's when you search out for your other support.
I just want to add to that and say that a lot of times I think caregivers feel like they're the court of last resort. Like if everybody says no, then I have to do it. And it's a hard change for your whole group around you to make, for them to realize that just because they say no doesn't necessarily mean that you can do it. Sometimes what you need to say is, we have a problem. We need to solve for this. We need to figure out what we can do. I am not able to do all of it. So maybe we can break it down into smaller pieces, or maybe we can think of some new options we haven't thought of already, but let's work together on this. And please don't assume that I'm going to be able to pick up whatever's not being done, because I really can't.
Thank you. And as we were discussing this, I know some people were interpreting the question as well as, what do I say to a family member when I cannot do something and I say no, and they have comments or try to make me feel bad?
Mm-hmm. Well, they'll do that sometimes because it may be a habit. It may be that they feel just sort of entitled generally. And so when people say no, I think you say, okay, you're not able to do that piece. I'm not able to do that piece. Let's figure out how we can get this done.
Great.
One of the things that we do when we think about who, like, the things that you need help with and making that list is also thinking about people who might be able to fulfill that ahead of time. So there's some plan about who to ask for help and what you're asking.
And that's something that that the Rush Caregiver Intervention is very involved with, is expanding that team like we were talking about, and really listing who can you ask for help from, what do you want to ask each of those people, what's their phone number or what's their email address, or how can you get in touch with them, and how are you going to know when it's time to ask them for that. So we really dig into the details.
That's great. And it does look like a few other people in the chat. So someone was just explaining their situation. I'm taking care of my wife, but also checking in with my mom, who's diagnosed with dementia and Alzheimer's. My brother lives with her and is retired, but slow and autistic, very difficult. So just kind of explaining their situation. And is that something that the Caregiver Intervention Program would be able to assist this individual with, and just managing kind of their load and making it a little bit less difficult?
Yeah, absolutely. Let's see, Allie, do you want to describe the 3 parts of the caregiver intervention?
Yeah, I think that'd be great for our listeners.
Yeah. So the 3 parts of the caregiver intervention, we meet with caregivers one-on-one, either over the phone, or I see people in person in the office here at Rush on Mondays and Fridays. And we do validate parking when you come in. So if that might be a barrier, don't worry about that. And what we do is we do these What Matters family care planning meetings, where we talk about what matters to you, what matters to the person for whom you are caring, and how do we create a plan that feels sustainable. Some of the components that we talked about with the self-care, that's a big piece of the conversation, and incorporating help. You would get a toolkit with different worksheets to accompany the sessions. And these are things that can be helpful, as we work together, but down the road too. We can also offer care team meetings with the different care providers. Yesterday, I had a conference call with a caregiver and the rehab facility where the care recipient was at, to talk about what needs to happen when the person comes home, and what that support might need to look like. We can also bring in other family members. We're going to bring in another family member for this caregiver who I am referring to right now, and see what support needs to be different moving forward. We also can offer help with skills training, getting with other healthcare professionals to learn about different skills you might be managing at home. Maybe that's nursing related, how to work with different equipment. Maybe it's connecting with an occupational therapist, physical therapist, to learn some skills so that you don't risk injury to yourself as you're helping the person get around. So those are the 3 things that are on the menu, and any mix of those, or any combination, or all of them, can be something that you might benefit from.
Yeah, we really do a thorough exploration of what your needs are before we figure out what the intervention is going to look like. And we really customize it for each person, because everybody's needs are different.
No, that's amazing. It's definitely that caregiver support, and you're really there to support that individual. I know a few other people in the chat. One just mentioned they're a primary caregiver for their mother. She resides with her. He has 2 sisters. They do not do their part and share in taking care of mom, her appointments, picking up the meds. So he's kind of doing it all on his own. So, you can definitely take advantage of that program Allie just explained, and you can have that plan and to better get you that support that you need.
We also, as Allie said, when we bring in these other family members, sometimes it sort of moves things from being stuck. It's hard for people sometimes to say as adamant a no, I expect you to do it, when they're having to say that in front of someone else. So that can be helpful. The other thing that, comes to mind for me is someone once told me, just because somebody is diagnosed with an illness or a disease doesn't mean that your old family issues just magically disappear. They don't. And in some cases, often, they get more intensified. And that's something that we really pay a lot of attention to. We know that that happens. And Allie and Diane and I have all been trained in working with families and doing family therapy. And we bring those skills to the caregiver intervention. So that's a very helpful component.
Yeah, that's awesome. I think a lot of people too, they continue chiming in on the chat, and someone mentioned, I like the card, I can't do it, cut out the T to can do it. And just like being able to say no, because it's hard to say no. Let's see if I'm missing anything else. And then someone lives in Indiana. Do you service individuals in the program that live outside of Illinois, or are rush patients?
We can talk with someone on the phone if they're outside of Illinois, but we're licensed to practice in Illinois, so we have to confine our actual intervention to people who live here.
Thank you. I think those are the rest of the questions. And then one last one. That's very nice way to respond. Thank you for the presentation. I agree. Thank you, ladies. This was an amazing presentation, especially during Caregiver Month, and just learning a little bit about skills and tips that they can use, as well as the program that we have here at Rush on what they can take advantage of. So definitely be on the lookout. I know all our callers, we send the newsletter each week and month and quarterly. So if you're not on our list, I sent my email in the chat. You can get on that list. And we do talk about the caregiver intervention program, but don't hesitate to use that number and call them. That number again is 312-563-0350 for that program.
Thank you so much, Danny. Thanks, everyone.
Yeah, we really appreciate you all for joining us today.
Thank you so much. And we'll go ahead and give everybody some time back of their day. Oh, one more question came through the chat. Let's see. Yeah, so just one last question before we close out. I'm concerned that taking care of my mother and my aunt, who all have some form of mental health issue that is taking its toll on my mental health. Can I help with that through the caregiver program?
Yeah, Diane, do you want to address that?
Oh, absolutely. As you heard in the presentation, there's complexity with many of our care recipients, and we are here to support and help with the caregiver's well-being. That's kind of the primary focus, as well as we hope to impact the well-being of the care recipient. So absolutely, I hope you do reach out to us. Hopefully, now that you've kind of talked with us and that are involved in the program, you feel kind of connected to us and know that you'll be welcomed warmly, and we are here to support you and talk to you about what will work best for you. And so thank you so much for sharing that. That can be just, it's just really challenging. And I know that you are doing everything you can and doing your best. But like we've mentioned, none of us can do it all, and we need some support and some help and some plan on how to best take care of ourselves. Because, if you don't hear yourself, it's that old thing that we all hear about putting your mask on, the oxygen mask on before you do the other person, if you fly in a plane. It really is, because you are the person caring. So it is important for you to get some support. So thank you for that, for sharing that with us today.
I've thought about that oxygen mask analogy, and I think as a parent years ago who was flying with a young child on a plane, I would have done anything to get that oxygen to my child before myself. And I think caregivers I think caregivers are similar, you know,
It's
I'm
true.
not going to give to myself before I give to someone else. So
Yeah.
sometimes it's easier to think of it as both and. You both breathe oxygen, you know, you both need oxygen. And care doesn't just go one way. One of the things that we focus on in the caregiver intervention is how the care recipient can be supportive of the caregiver, in addition to the caregiver being supportive of the care recipient. So, you know, it's a mutual relationship as much as it's possible. Sometimes there are limits on that, but sometimes there's more that can be done in the other direction that ends up helping the caregiver.
It's a great point.
We really hope that you'll give us a call and look forward to working with anyone who's interested.
Yes, thank you again. And then again, just everybody's just saying thank you in the chat. They really enjoyed this presentation today. And then I know some people too are kind of running around and driving. So if you miss anything in the chat, it will be live on our YouTube page, and then you can view it at any time at Rush Generations YouTube, and you can go ahead and rewatch this and learn any other tips that you missed. And I just want to make sure we are all good. So go ahead and have a wonderful rest of your day, and we look forward to seeing everybody else at someone said that they will call, they need help. So they're live. Caregiver intervention team is live and they're ready for your calls. But yeah, we'll definitely see you next time at our lecture, December 8th, for the new normal. Everybody have a great day.
Thanks,
everyone.
Thanks, everybody. Take care.